Symptom Wednesday, episode 2. Today I want to talk about procrastination and motivation from the angle of advanced conversational hypnosis. Most people in the coaching industry are thinking that procrastination is something to do with time management, willpower, motivation, or even like if you dig deeper, maybe it's overwhelm, maybe it's whatever. However, as I say time and time again, within advanced conversational hypnosis, we make no assumptions when we go into the session, right? We make no assumptions and we investigate it. It is a symptom. It is a symptom that a person wants to do something and they cannot do that thing that they want to do. And this is the reason why when you give your client like some sort of a time management techniques or the list of tasks that they need to tick off as they go through the day, it just doesn't work. Or maybe on the surface level it might work with a lot of willpower, and then it will stop working because the unconscious payoff is still there. The bigger problem that hides behind the symptom, that is procrastination, is also still there. So basically pushing through it, there's no point because you can push through it. And I've seen clients who were trying to push through it and then they came to me and they're like, look, this is so hard, it's taken all of my energy trying to push through it, and having that willpower to actually do things that I know I need to do. And I've read all of them techniques. I've used the 15-minute slots for, work for 15 minutes and then 5 minutes don't work, and etc., etc. So within advanced conversational hypnosis sessions, we actually dig deeper and we investigate what actually is going on. We're not trying to give them more motivation or hype them up so that they are good for 2 days and then they fall back because the real issue has not been sorted. So, we ask questions like, okay, so you're procrastinating, you're not doing something that you know you need to be doing. So what are you avoiding? As simple as that. What are you avoiding? Or what part of you benefits from procrastinating? Because if there was no unconscious payoff, they would not be procrastinating, right? And sometimes, and procrastination and motivation, I don't feel that they are on the same kind of scale, that one is at one end of scale and another one is the other end of spectrum. Because it's not really about that. You don't have to be super motivated to complete your task, really. And even if you're not motivated, if you've got discipline, you can still be doing what you need to be doing. So it's not about that. So we don't really give them the motivational pep talk. We don't try to fix them consciously. There's always unconscious payoff. So during that hypnotic investigation, investigating the symptom, and from the symptom going deeper into the real problem, what actually is happening, we watch the unconscious emerge. This is what we call unconscious moments, and I have a Udemy course if you want to learn about unconscious moments and actually apply it to your practice. So anyways, so we watch the unconscious emerge. We know how to ratify these unconscious moments and direct the client to a positive resource. And by directing, I'm not saying giving suggestions. This is not about suggestions. By directing, I mean asking questions that will actually make them think about what the real problem is, and that will make them find their own positive resource, positive solution. Look, and I've had clients, so I'm going to give you a few examples of the clients that I had with the issue of procrastination. So I've had clients that came to me and they were like, oh, maybe I'm depressed, whatever, like, and or they are trying to like dig really deep, or we as therapists trying to dig really, really deep and thinking, oh my God, maybe this is, if it's not, if behavioral hacks don't work, but maybe this is depression, whatever. And I had instances where the client came and she was like, you know what? I just need to change my sleeping cycle. I just need to go to bed at 10, wake up at 6, and this is when I do my best work. So she was aware of her most productive time of the day, where she can actually do things that need to be done, and the unproductive part of the day she could actually relax a bit more once everything is done. And this was her solution. So it wasn't even anything complicated. It wasn't even anything to do with some deeper childhood trauma or whatever that they are like afraid of failure or whatever. Sometimes this is what they need. And if you had assumed that procrastination or lack of motivation is about something different, then you would be steering the client in a direction that you think, and they would not find their own resource, because only they know what exactly they need and what is happening with them. And your job as a therapist, hypnotherapist, coach, is to actually guide them towards their own resources. It's not to resolve things for them. Because I could have told her, like in the beginning, oh, what if I don't know, I've got like 5 action steps for you to figure out which one is best for you. And then what if you done this Pomodoro technique? And they're like, no, not that. Okay, so what if you found the most productive time of the day? And they probably would have said, no, not that, because they wouldn't have realized it by themselves just yet. So through the hypnotic investigation and through our conversation with them, we make them realize what is the best action for them, or what is the best solution for them. And sometimes the solution can also be a shift in perspective. Maybe they were finding this task completely boring, but now they know how to add more fun into it. Whatever it might be, it's their solution. So if you want to learn more about hypnotic investigation, advanced conversational hypnosis, unconscious moments, how to make sure that the client finds their own solution without you doing the work for them that they won't relate to because it's not their solution, then comment under this video or drop me a DM and we can have a chat, and I can tell you all about the amazing method of advanced conversational hypnosis.